I'm ready to get out of here. Hopefully the doctors will get us out of here before noon.
Be patient, Louis. You're getting out of here soon.
Is the door unlocked? And did the eagle fly? I'm waiting on my mail. Is that you? Close the door, Fanny. I'm gonna go on to sleep. Thank you. All right.
Miss Can I help you?
Yes, I need to use the bathroom right now. Can someone please help me?
We are in report right now.
I'll be there in 30 minutes.
Hey, we made it, you know.
Yeah. Okay. Somebody help me!
She pushed me.
Don't worry, Louis. You'll be going home soon.
Help me! Oh no!
All patients who enter the hospital are at risk for falling. At Madigan Healthcare System, we use a system with 4 key components for fall prevention. It's the acronym PARC.
P stands for Prevention Protocol. At our hospital, we implement a universal set of interventions to prevent falls. A stands for Assessment. Our hospital uses the Johns Hopkins Fall Assessment Tool to assess a patient's risk for falling. This tool categorizes patient risk into low, moderate, or high risk, prompting implementation of appropriate prevention protocols. R stands for rounding.
I'm Lieutenant Baggett. I'm going to be your nurse today.
Evidence shows that rounding on your patients every 1 to 2 hours can reduce the frequency of patient call light use, increase patient satisfaction with nursing care, and reduce falls.
7 patients on falls precaution.
C stands for communication.
He's a high risk
It is
for
imperative that every team member have an awareness of all patients at risk for falling on your unit. Also, patient and family education is vital in preventing falls.
That's pretty much all I have for
All patients at the hospital are at risk for falling. Our prevention starts with implementing a universal set of prevention precautions for all patients, regardless of their risk level. These interventions are part of a new admission order set. These interventions help create a safe environment and encourage patients to call for assistance. Here are some ways to promote a safe environment. It's important to remove excess equipment, supplies, and furniture from patients' rooms and hallways. Most falls occur around the time of toileting, so ensuring a clear path to the bathroom is essential. There are many cords and wires around patient beds. Coiling them and tucking them away from patient access makes for a safer environment. Sometimes this equipment gets in the way of a patient's personal items. Slips and trips are mostly related to water or urine spills on the floor. So remember to keep the floors dry.
How you doing, Mrs. Zucchero?
While the patient is in bed,
Good.
don't forget,
You're kind of up in the sky.
keep the bed in the lowest position possible.
I want you to be close to the ground.
And make sure
And your bed's not even locked.
the bed wheels are locked. Side rails can be placed in the up position to help your patient move around in bed and to make bed adjustments. But remember, 4 side rails up is considered a restraint. If 4 side rails are up for patient safety, it must be documented in the patient's record. 4 side rails up doesn't reduce patient falls, but can actually increase the risk of injury if your patient tries to crawl over the side rail to get out of bed.
Have you used this before?
A hospital is a busy place, so it's easy for the hospital staff to appear rushed. Placing the call light within reach and encouraging patients and family members to use the call light gives permission to use it
Well, if you push this big red button right here,
and assures your patient that the staff will promptly respond to their call.
be in within 1 to 5 minutes.
Sounds good.
I'll hook it around here so it doesn't fall down again. And you push it, I'd be glad to help you. It's my job to help you.
Our hospital uses the Johns Hopkins Fall Assessment Tool. We assess a patient's risk for falling during admission and on every shift. This tool assesses the risk for falling by considering age, fall history, elimination pattern, medications, patient care equipment, mobility, and cognition. Nurse James is about to use the fall assessment tool to assess whether or not Ms. Anderson's risk for falling is low, moderate, or high. The first section of the tool assesses age. Now, Ms. Anderson is 85 years old, therefore receives 3 points in this category. The second category is fall history. Now, if a patient has had a fall within 6 months before admission, they receive 5 points. 2 months before this hospitalization, Ms. Anderson had a fall. So she receives 5 points. The third category is elimination. Our nurse is retrieving briefs from the Omnicell because Mrs. Anderson urinates frequently and is often incontinent. She receives 4 points. The next category is medications. High-risk medications are a PCA, opiates, anticonvulsants, antihypertensives, diuretics, hypnotics, laxatives, sedatives, and psychotropics. Now, our patient is on 3 high-risk medications, so she receives 5 points in this area. The next category is patient care equipment. Patient care equipment is any equipment that tethers a patient to a bed. For example, an IV infusion, a chest tube, Foley catheter, or SCDs. Ms. Anderson is constrained by her IV infusion and her SCDs, so she receives 2 points. The next category is mobility. A patient receives points if they require assistance or supervision for mobility, transfer, or ambulation. Your patient also gets points for having an unsteady gait and if there is a visual or auditory impairment affecting mobility.
Hi, Miss Anderson. I'm Nurse James, and I'm going to help you go for a walk.
Just a second, James. I gotta find my glasses.
In this category,
some help?
select all that
Got
apply,
it.
then add the points together. Now, Ms. Anderson needs assistance with ambulation, has an unsteady gait, and a visual impairment. So, she receives 6 points. The last category is cognition. A patient receives points if they've an altered awareness of their immediate physical environment, are impulsive, or have a lack of understanding of their physical or their cognitive limitations. In this category, select all that apply and add the points together. Ms. Anderson is aware of her environment, is not impulsive, and understands her physical and cognitive limitations. Therefore, she receives no points here. Ms. Anderson has scored 25 points on the Johns Hopkins Fall Assessment Tool. This score puts her at high risk. If she'd scored a 0 to 5 points, she would be at a low risk for falling. If she'd scored 6 to 10 points, she'd be at a moderate risk for falling. Scoring over 10 points means she's at a high risk for falling. So for each level of risk, there's a standard nursing order set with fall prevention interventions. Low-risk interventions are implemented for all patients on admission and are documented in the new admission nursing order set. When a patient is assessed at moderate or high risk, the corresponding fall prevention order set should be initiated. You are responsible for making sure that the order set is initiated in a centrus and that the interventions are in place. Interventions for patients at moderate risk for falling include identifying patients with visual cues. These visual cues include yellow non-skid socks and a yellow wristband on your patient. Posting a falling star sign in an easily seen area in the patient's room and one on the census board. This will alert the staff that fall prevention precautions are in effect. To assist your patient with transfers and ambulation, be sure to remember, use an appropriate assistive device, such as a walker. Transport your patient throughout the hospital with the assistance of staff or a trained caregiver. Make sure that a seat belt is used when your patient is in a wheelchair. Falls often occur during toileting. This is why it's important to establish a schedule. For example, offer toileting assistance every 2 hours. Scheduling may prevent your patient from attempting to get out of bed without help. Interventions for patients at high risk include the moderate risk interventions, plus these additional interventions. You must stay within eyesight of your patient at all times while they are toileting. For patients who have an altered awareness of their immediate physical environment, are impulsive, or don't understand their own physical or cognitive limitations, move your patient as close to the nurse's station as possible. Use a bed alarm or a personal alarm, and consider a one-on-one center.
Stay in there. Oh, no. Here, let's get your legs back up. It's okay. It's okay. Here, lay down. Yeah. Look at that. Calm down. Relax.
The next step in our systematic approach to prevent falls is patient rounding. Now, rounding is a simple concept. We check our patients every 1 to 2 hours using a standardized checklist, which bundles the care and activities while in the room. Research shows that this can reduce the frequency of patient call light use, increase the satisfaction with nursing care, and reduce falls. Patients are actually less likely to use their call light or attempt to get out of bed without help if they can count on you to return to the room at a specific time. It has also been shown that nurses are more satisfied because they're less likely to get interrupted by a call light.
Can I help you?
When you round, think about how to adapt the steps shown in the following scenario to your individual patients.
Miss Smith?
Yes, dear.
Hi, I'm Lieutenant Baggett. I'm going to be your nurse. Can you please tell me your full name?
When you enter the room,
And I'm going to check
tell your patient who you are, your title, and why you're there. In this case, to do bedside rounds.
Okay, good.
Do a quick environmental assessment by checking hazards or obstacles, such as lines, tubing, electric cords, or personal items that could cause a fall.
Okay, Miss Smith, I'm going to show you your items here and get them in a comfortable range for you.
Put the bedside table next to the bed. Then make sure that the call light, phone, water, tissues, and garbage can are within easy reach of the patient. Check your patient's pain levels using a pain assessment scale.
How's your pain, Miss Smith? Did that morphine help?
I think it helped. My pain's about a 1 out of 10. I can handle that.
Okay. Do you need to use
Offer toileting assistance.
I'm actually okay right now.
If they decline, tell them you will return within the next 1 to 2 hours to offer assistance again.
How's your position, Miss Smith? Are you comfortable in the bed?
Assess your patient's position and position for comfort.
All right, I'll get that.
If they have impaired mobility, reposition them every 1 to 2 hours. At the same time, perform a skin assessment by checking for reddened areas, moisture from incontinence, excoriation from body fluids, dressings that need changing, and overly dry skin that needs lotion.